Hello, hello.
Hello.
Excellent. All right, we have everything set up. Sorry, I was getting the recording ready. This time we have video for when we post it to YouTube. So it's 1 minute past 8, so why don't we go ahead and get started. For those who are listening along, we really appreciate it. This is our second community AMA, and we'd like to welcome you. We're looking forward to answering your questions. So to get started, I think introductions. Wojciech, why don't you go ahead and get us started with this?
Sure. So my name is Wojciech. I'm a medical doctor by profession. I'm actually passionate about blockchain and decentralization after years that I have spent building humanitarian and high impact organizations. At Data Lake, I'm the co-founder and the CEO.
Fantastic. Ligia?
Hi, hello. My name is Ligia. I am a co-founder and chair of the board in Data Lake. I am also a medical doctor. I worked in Polish Hospital Federation as managing director for 7 years now. And I work on access to medical data on the Polish government level and EU level.
Fantastic. And my name is Denny. I'm the global head of PR and marketing. I have a background in direct-to-consumer marketing as well as nonprofit communications. I've worked for with the European Commission on some of their communications as well. And I've also been in crypto for a long time, I think about 10 years now. I launched one of the first B2B companies that accepted crypto as payments. This is way back in 2013. So I've been around for a while, and yeah, we have a super talented team. As we do these AMAs in the future, you'll definitely get to meet more and more of the people that make up Data Lake. We have our dev team, product team, we've got our crypto team, so we've got a lot of people who you'll meet as we do more of these in the future. All right, now that everyone's introduced, I'll get started right away. No better way to get started with our community questions. And Wojciech, I'll start you off with this one, and then Ligia, you can answer as well. From the community, what have we achieved since our last AMA, which for everyone listening was about a month ago?
Sure. So actually, many things happened. As you know, as we told you during our last AMA, this quarter is the quarter where we heavily focus on delivering business value and keeping up our promise of securing key business partnerships. So this was our main focus, and I know that Ligia will elaborate on that. But we have also designed a new web page, a new white paper, a new tokenomics, which is very important because I treat it more as an evolution than a revolution of what we had before. We have introduced mechanisms that are great for token value accrual and for building long-term value of Data Lake and the Lake token. We have also made place in our ecosystem for different players whom we invite to join us and basically help scale the data donation idea globally. What we've seen, just to give you a little bit more background and more explanation, what we see is going to be a bottleneck or a challenge that we know that we have to address, and we don't want to do it alone. We want to do it with partners, is the consent collection. So reaching out to community, reaching out to patients and actually convincing them to become data donors. And the second bottleneck in scaling is connecting our Data Lake system with the hospital repositories to be able to physically download the data from them. And although the first flows of data and the first instances of collecting the consent we are going to do ourselves with our team capacity, we have also designed an ecosystem where different parties, different entities, different people will be able to join, collect consents on our behalf, help us onboard data donors globally, as well as help us to plug into repositories of healthcare data globally as well. And we often compare ourselves to blood donation or bone marrow donation. And by opening the ecosystem in a truly decentralized, open way, we see that we are bringing down barriers of scaling, basically, because it's all digital. Leaving a consent with Data Lake takes 30 to 60 seconds. Anybody can do it, and we won't be doing all the heavy lifting, all the work ourselves. So we've done a lot of design. We've consulted the tokenomics extensively with a lot of industry partners, both from the crypto side and the healthcare side. And at the moment, we are confident that what we have designed will withstand what's yet to come, and will help us build a medical data donation system that is tenfold as successful as the blood and bone marrow donation systems that we see working all over the world. So this was a short note on the tokenomics. You can also see that we have redesigned our website, thanks to great work of our marketing team. And it's also an important message from us, because it shows the kind of messaging and the kind of positioning that we want to convey as Data Lake, not only as a crypto project, but also as a movement that appeals to a broader array of stakeholders, to patients, to hospitals, to researchers, but also to the community and to investors. So if you haven't seen it, go check it out. It's beautiful, it's worth seeing. And I'm sure that Ligia will be adding something on the business development side of what we've done.
Yes, so of course we secured a couple of new partnerships, and we have more orders on medical data. But what is absolutely crucial, and you don't know it yet because we didn't publish it yet, we actually managed to sign a binding agreement with our first data provider. So we are actually ready to launch first data donation campaign targeted for this data provider. It is a medical entity that is affiliated with the one of the most respected medical university in Europe. So it's mind-blowing actually, because we just confirmed that we will have data providers willing to start with us, and even faster than we actually thought. Second thing is we are now preparing for official launch of our product. We think that it will take place next month, and right after this launch, we'll start official data donation campaign for patients. And we believe that after 2-3 weeks, 1 month, 2 months, we'll be able to secure first data flow. So maybe it will be possible to conduct these couple of first data flows before IDO.
I think we can also drop another alpha. As you know, we are rallying support behind data donation idea internationally, which also involves inviting to Data Lake capital partners from all around the world. Having said that, we know that we need the right partners that understand what we do from the healthcare perspective, that understand that we are who we are, that we are building another donation scheme in medicine, and we are very excited to announce that we have found a first partner of that kind, which is a venture capital firm from the US. It's called Orange DAO. It's created by Y Combinator founders, Y Combinator being the best, the most known and the most recognized accelerators for startup from the US. And the whole network of founders working heavily on decentralized science movement, of which we are part, is joining Data Lake as our cherished investors and advisors. For sure, there will be more partners joining us, which we hope we'll be able to share with you shortly. But this is the first partnership of that kind that shows that not only hospitals, not only patients, not only data buyers, but also investors who invest in DeSci projects internationally start to recognize what we are building as Data.
Yeah, and this is huge. So, I mean, for people who have maybe followed more typical crypto projects in the past, you know, they have a token and it's usually maybe just within their ecosystem, maybe some functionality. And you may not be used to a project like ours, which is really bridging the crypto world, the traditional finance world, and then also the general public, as well as scientific institutions. And so what we're working hard, whether it's the tokenomics updates or creating new stakeholders or forming new partnerships, even, you know, from the data provider side to all the way through to investment, what we're doing is creating a link between all of these groups, all of these sectors. And this is why Data Lake is very, very different from other projects because we're building real world use cases. We're going to have people contributing their data to our system. There's a demand for it. We may talk about this a little bit later. And so it's really exciting to start to see these pieces fall into place, especially over the last couple of months. So it's really, really exciting times. And then, from the marketing standpoint, as you may have noticed, our community has definitely been growing. Our numbers have been going up. And then behind the scenes in our analytics, there's a lot more people coming to our website. And we're doing a lot in the PR realm of things. So we were featured in Startups to Follow, which is a website that tracks the most promising startups in the world. We were also featured in a story by CoinWire talking about our data donation system and how that's using the blockchain. I also participated in the Crypto Jobs AMA where we were talking about data privacy in the blockchain and presented our project. So we've been doing a lot. Our press releases also just went out on outlets such as CBS, USA Today, Digital Journal, and we have some really exciting publications and features coming up for the next month. So all that to say that we're building a lot on the marketing PR side. We're building the chatter, the excitement, the momentum leading up to the exciting things that we have coming later this year. So if you're joining us from one of those efforts, you found us on the website or through some of the AMAs and other interviews we've done on other channels, welcome. It's great to have you, and it's going to be a very exciting ride. So speaking of getting started and things coming up, we had another Telegram question from a community member who wants to know what are the next milestones that you're working on achieving. I know the answer is a lot, but Ligia, why don't you start first?
So the first and most important milestone is opening up our consent app for actually everyone who wants to donate their data, and we have it ready, fully prepared with KYC integrated, etc. We are just waiting for the best date to do it and to create some momentum and event and articles about the moment that we open our system. After that, we will run a campaign for patients, a targeted campaign in a medical entity that we cooperate with. And after that, probably after 1 month, we will secure first data flow. So the most important milestone, maybe even, is conducting this first data flow from data provider to our system, and it's our actually crucial aim right now on what we focus on.
So, if I may build on top of that, there's also been questions from the community about the IDO, which is a valid one. And our plans don't change. So basically, the Q3 is dedicated to business development, launching our product, preparing the momentum for the IDO, while it is our pledge and our promise to all our investors that we are going to have an IDO by the end of the year. Specific date is yet to be announced, but for sure, you may expect listing of the Lake token before the end of 2022.
And regarding the IDO, so I'll put it in the chat later on, and of course we'll do an announcement, but we have launched a waiting list or a newsletter waiting list for people who are interested in the IDO, and through that you'll get updates over the next coming months about IDO news, that sort of thing, and you'll also get an instant notification as soon as the IDO happens. So as soon as we're trading on the DEX, you guys will get the first notification through this newsletter. So you can sign up, just either go to data-lake.co/IDO sign up, or I'll put it in the chat after the AMA and you can sign up directly from there. So shifting focus a bit, we have another question that came in earlier in Telegram. I see the logo of the European Union and of Poland in your website. Can you elaborate on how come they are there? Is it just to represent where you come from? Are we just proud? Ligia, Wojciech, whoever wants to take it.
Yeah, let me take that. So at the nascent stages of Data Lake, we are financed with a grant disbursed by Polish Agency of Entrepreneurship Development from the European funds, but it was a regional fund from the Republic of Poland. And we actually have the right to use the logos. We are obliged to use the logos because we are directly supported, and what we are building, our donation system, is directly supported by the European Union with a grant for product development. At the beginning, we actually had to go through an extensive analysis and incubation period, where we've got the green light and the confirmation that what we are building is actually in line with the core values and the long-term strategy of how European Commission and European Union envisages exchange of data. So I know that we've been talking about that a lot, but I think it's interesting to mention it once again. To be able to see what is currently going on in the world. And what is going on right now is the collision of two mega trends. And one of these trends is the trend of evidence-based medicine, of AI development, of medicine that requires data and that has a still unsatiated and ever-growing need for consumption of data. But on the other hand, we have the trend for privacy protection, where European Union is especially strong. And the collision of these two mega trends causes that most of the people, most of the countries actually have to choose. Do they want to sacrifice the access to data, or do they want to sacrifice the right to remain private? And the problem that we are solving is actually a problem that is universal for the whole Europe, but that is also coming up all around the world, where people want access to medical data, but in the same time don't want to sacrifice privacy. So we believe that there is a better way. We don't have to sacrifice anything. We don't have to go on compromise, but we can build a system that both makes data available and keeps individuals, patients, data donors private. And this is something that lies at the very heart of the EU, because the whole European Union needs data and we are lagging behind the rest of the world. But in the same time, we are not ready to go on compromise and make our data available to whoever may wish without our consent. So this is the reason why we are actually proud to be supported by the European Union, because we see an alignment of values between what we do and what the European Union wants to promote.
I would like to say that we are not lagging behind, as a data lake, as a global data donation scheme, because you know about the Data Governance Act that was approved by European Union, and I was a part of the working group discussing the Data Governance Act and Data Donation Scheme. And I was invited to present our case of global data donation scheme on the meeting that there was couple of other participants from all over the Europe. And there were presentations, and a person from Germany or person from other European country were like, okay, we are thinking about what this consent should do. How should we write this consent, or should we do it as a university, or maybe not, or maybe how to create this whole scheme. And then I had my presentation and I was like, yeah, we have system ready, we have integrated KYC, we have consents ready, and we are actually starting our campaign in 2 months. So it was great feeling to know that we as a project, as a global data donations project, but project that comes from Poland, from Warsaw, is actually in the first place in this race when it comes to data donation.
Yeah, no, it's there's a big push coming from the EU. There are EU members of Parliament who are saying we need this, on the floor of the Parliament, speaking in Brussels. And that's a big key to why it's the right time, for this project, and why we have all the right pieces in place. And we will be, for sure, I think, seeking to work as closely with the EU as possible as we go into the future, because we see them as key stakeholders, and they also make the decisions that govern our project and data donation. So important to stay close to them. Along the same lines, somebody asked a question: are we planning to expand outside of Europe as well? And what would be the timing for that to happen? Ligia, how about you want to take that one?
Sure. we think about data lake and lake token as global system, and of course we are starting in Poland, and we would like to, our main aim is to secure first data flow, but the next thing after data flow is actually taking our old scheme and implementing it in other countries. So probably in the in fourth quarter this year, we'll actually not start, but maybe we'll do it more often. We'll contact other institutions around the European Union, probably in first, for selecting probably trust entities to implement our data donation scheme in other country. So we plan to do it by the end of the year. We are actually in discussions with some of the countries and some of the institutions, and we believe, because the idea about people having a right to decide what is going on with their data, and patients having right to control what is going on with their medical data is a very strong idea that is not only for Poland, and even not only for European Union, because this is a message that is very strong, for example, in the United States. And even if it is easier to have an access to medical data in the United States than in European Union, because we have GDPR, and we have this feeling, very strong feeling about rights to privacy. Even if so, like the idea about patients deciding about their medical data is like universal across all the world. So for sure, it is global data donation scheme, and we are preparing to implement it in other countries.
Awesome. Great response. Just to add to it as well, right now we purchased the domain donateyourdata.io, which as of right now just holds the waiting list sign up for if you're somebody who, because we're also looking for where the interest is, and there's data out there on that, but yeah, we're definitely looking at the international expansion, and then the EU, then the world will take it over.
Guys, let me step in. There is Dini, you're having some terrible robotic voice. I didn't know that you're a robot so far. There is probably some interruption on the network. So let me just repeat what Dini was saying, that we actually have purchased a domain donateyourdata.io, that will make it possible for everybody from all around the world to actually go there and start data donation. So from the design, from the very beginning, from the tokenomics, from the communication perspective, we are thinking about data lake as a global system. Our team is multinational. We are working over 6 countries right now, with half of the team being fully remote. So we couldn't be more prepared to building the first truly multinational donation system.
Can you?
Cool. It's actually worth.
Yeah,
It's actually worth mentioning that we already have orders for medical data from international companies. So, in that meaning, we are international already.
Absolutely. A question that came in the chat in the meantime: have you encountered any problems with data acquisition? And the questioner is talking about the activities and progress of the project so far.
Problems with data acquisition. Okay, so we'll start collecting data after first data donation campaign, after having patients' consent, and then we'll collect or download their data from medical entities. So it's a thing that is ahead of us. And our IT team is working with IT department in the medical entity that we started cooperation. And like right now, we don't see any huge obstacles when it comes to downloading medical data from that entity that we started cooperation. I feel that we are well prepared, and this IT department from medical entity is well prepared too. But we will see how it goes when it will be the time for the first data flow.
Guys, of course, there's gonna be challenges. We are building something new, so we expect the challenges, but we are also prepared for them, and we actually cannot wait, to solve them one by one. So we'll be sharing with you the progress in an open manner, the way we do now. So you'll be aware what's going on the road. But yes, of course, there will be challenges. We are ready for them. Bring them in.
Another question that came in actually after our last AMA, but we didn't manage to get to, along these lines, is there really actually that big of a data market for medical data?
It's something that you don't see at the first glance, because it's not like market for anything else that you can openly trade and where you can openly participate as a, let's say, casual citizen, but it is happening. And we have actually put together an extensive research on how different life sciences companies, how different research companies acquire, purchase, and process medical data. But just for you to be able to calibrate how big the market can be, imagine that for every discovery in medicine, that for every drug, every medical device, for every technology, every algorithm that you bring to the market and you certify, you have to have evidence that supports that it works, and that evidence has to be based on compliantly sourced and big data sets. So think about healthcare that constitutes, over 20% of GDP of the US. Think about pharmaceutical industry, which, up to my knowledge, is the second biggest industry in the world. And think about these industries that consume huge amounts of data on a daily basis. So even though it's hidden from our eyes, even though you cannot go on eBay and purchase medical data sets, if you'd like to do so, there is a huge market. And we have proven it, we have seen it. We have companies that approach us on a regular basis and ask if we have found a way of supplying medical data to meet their needs. But there is also publicly available research that, for instance, shows that the value of medical data stored in European hospitals amounts to $100 billion a year, that the value of the healthcare analytics market in the whole world yearly is about $35 billion. So yes, the market is huge. We just don't see it at the first glance.
And one more thing, there is more and more digital health data, because the digitization is going on, and I think to 2025 we will have like 36% of all digital data that is created in the world will be like health data. So this market, when it comes to digital data, is growing too.
Fantastic. So then we have one last question that came in from the community. Maybe Wojciech, this one's for you. Do you feel the crypto winter / bear market, whatever we're in, has it had any impact on the projects? And do you have any thoughts on timing in terms of launching the IDO and if it has any impact there?
Sure. So basically our approach is that we do not try to time the market on the crypto side. We know that we are right on time with our solution, that we have the right solution for the problem. And we know that basically if we solve the problem and if our solution is right, then regardless of the market circle, regardless of the bear or bull market, we are going to be hugely successful. And if there is any effect of the bear market on Data Lake, I would rather say it's a positive one. We have the time and the headspace to focus on building. we have the time and the headspace to choose the right partners, to let the idea mature. And we know that we are building for the next years to come. We are not a project that is going to launch and disappear after 3 months, after IPO. We are here to stay. We are here to build something huge, and we are here to construct, or put together a new donation scheme in medicine. And we know that won't happen overnight. So I am confident, and I know that during Data Lake lifetime, there will be, crypto winters, there will be bull runs, and we'll experience them all. So I'm not that much worried about the fact that we are on the bear market. Having said that, we also know that to build excitement and momentum and ensure good launch of our token, we also have to do it at the right time during our project life. And we believe and we know that the right time will be in Q4 of this year, as we approach the end of the year, as we have done what needed to be done from the business and technological perspective, and then we are going to launch. But frankly speaking, as the management team, as the CEO, I don't see negative effects of the bear market on the project so far.
Awesome. So we actually had a clarification from Camille, not sure how to pronounce your name, I apologize. He was wondering if we had any issues with data acquisition in terms of the data donors. So Ligia, maybe that's for you to share on maybe some of the statistics that we have on people's willingness to donate their data, as well as what we're doing on the patient side of things with our partnerships.
Sure. So when it comes to Poland, we have some statistics on how, if Polish patients are willing to donate their data. And
it's a bit worse than before.
Like the sound?
Yeah, now it's
maybe now it's better. Okay, great.
Yeah.
So when it comes to Polish patients, 77% of them are willing to share their data, and these are statistics from We Patients Foundation. We also have our own statistics. We did it with Ipsos company on 1,000 participants of Poles, not patients, but Poles. And almost 50% of them are willing to donate their data for trust entity as a foundation that we have. So in Poland, we actually believe that most of patients will share their medical data. I also can say from my medical experience that if we collect patients' consent, for example, to be in a clinical trial or to use their data in this particular hospital, like 95% or even 100% of patients donate their data. So it shouldn't be a problem. When it comes to other countries, 79% of Germans, not patients, but Germans, are willing to share their data. And when it comes to the United States, it's important, 94% of Americans are willing to donate their data for R&D purposes in medicine. So these statistics are very high. Of course, we have to check it, with our data donation campaign, and then we'll know for sure how many patients will give their consents. It is, it will be depending on how well we will prepare our data donation campaign too. So every patient know what are we doing, why we need their data, and we are preparing our data donation campaign with our partners, with patient organizations. So we believe that it will be very well prepared and it will be understandable for patients. And but looking at hard data, it should be good. It should be well.
Yeah, I mean, especially when you consider giving blood or even bone marrow, they're quite invasive. Bone marrow requires quite a test as well. So it involves needles and all kind. When we're asking someone to donate blood, and obviously people do this quite willingly, and it happens all across the world. Every single day, people are donating blood. Then you put it next to data donation, which really is going to be a couple of clicks, reading a document or two, and then contributing to medical science. I really think the barrier to entry is much, much lower. And there are some regional differences, with the data as we've seen, but also here in Europe, some of the Scandinavian countries are 94, 95% and plus willing to donate their data. So there's a lot of people who are willing to do this. And so there's a public education campaign that needs to happen, which of course we're working on to show people the importance. But in terms of it being a barrier to entry or somebody, having a problem with it, compared to giving blood or anything that involves needles, it's definitely a much smaller ask. So,
guys, in simple words, why wouldn't you do it? It takes 30 to 60 seconds. It doesn't hurt, and you get rewarded for it for the rest of your life. Why wouldn't you do it?
And you can call yourself a data hero or citizen scientist.
Exactly. So that we finished all the questions that came in from the community, as well as the one that came in from the chat. So I think that's pretty much everything that we have there. Oh, actually, no, sorry. There was one more question, which is about the Gleam contest, which is our Lake token giveaway that is going on right now. That is going on through the end of September. We just announced that one lucky winner won our monthly mega prize giveaway, and they've been contacted, and we have several more of those coming up. So if you haven't signed up yet, please go do so. It's in the pinned messages in our Telegram channel. If you have and you haven't been chosen yet, hold on, just wait, because we have more winners that we're going to be choosing. And then, as I said, in September, we will be finishing up the contest, and then you will be getting your tokens sent to you at Token Generation event before the end of the year. So we have $30,000 or over $30,000 in prizes. You can also win a seat in our data donation app as kind of one of the first people to be able to access it once that goes live. So yeah, that's super exciting. Thank you to everyone. We've had like over 1 million entries. So it's really, really exciting to see that. Thank you if you've already taken the time to sign up and perform the actions. We really appreciate it. So any last words from our co-founders before we end our second Data Lake AMA?
Stay tuned.
It's always a pleasure to talk to you, and I have a feeling that there is just so much to say that happens over month that this time that we are having for AMA with community is too short. But also remember that we try to be close to you. If there is anything that you'd like to know, if there is anything that you would need from us, we are always available on the Telegram group. So don't hesitate to reach out. We are building something together. We are building something with you. So to deliver on the promise, we'll keep you updated, but also you have all the right in the world to ask us questions and stay in touch in between the AMAs.
And actually, every day that we have and we work with each other, we have that feeling that we are a startup that develops very fast, and every day we have this feeling that is going faster and faster, and we have more and more information to share and more news. So yeah, stay tuned, and yeah, that's all. Thanks.
Thank you to everyone who listened. We'll be doing these AMAs monthly, so stay tuned and keep a lookout for the next announcement of our next one next month. And have a fantastic evening, everybody.
See you soon, guys. Bye.
Bye-bye. Thanks.
Bye.